Hi, my name's Anthony. I'm a paediatrician.
What is a paediatrician?
Paediatrician is a doctor for children. So sometimes when kids come in with their parents, I say, I'm here for you. I'm your doctor. I'm not mum's doctor. So we've done some extra training on top of our medical training, an extra 6 to 7 years of training usually of just paediatric medicine, of just looking after children and their medical and health needs. So we see children from birth all the way through to 18.
What can I expect if I see a paediatrician?
So when you come to see a paediatrician, we're going to go through a whole bunch of different things. It depends why you've been referred to see me. So we'll see little babies who might not be putting on much weight, all the way through to teenagers if they're struggling at school with their emotions or learning. We're going to talk about a whole bunch of things, but always about the child's health needs. So that usually means talking and then examining the patient and then coming up with what tests we might want to do. So when we're talking, we call that the history taking. And so there are things we go through, the past medical history, what illnesses they've had in the past. The family history is always important too. We go through their health needs, their developmental needs, how they're going with their development, their gross motor skills, their fine motor skills, language, how they're socialising with other kids, how things going academically at school. And then we'll examine the child or the older adolescent and decide what tests to do from there. And that can help us make up our mind about how we're going to help this child.
How can I access a paediatrician?
So to access a paediatrician, you have to have a referral from your general practitioner. So most problems are mainly dealt with your general practitioner, with your GP or nurses, like at Child and Family Health Services. If your GP feels as though they would like some help solving the issue, then they'll refer to the specialists, to the paediatricians, to help them with your child. So we will need a referral letter. And that referral letter could go to the public hospitals in the public system or in the private setting where your GP would refer to a private paediatrician where Medicare pay for those services, but there might be a small gap with that. So if you're unsure, when you ring up for that appointment, you can ask the secretary whether there will be any extra payment on top of the Medicare component.
Are there common misconceptions about paediatricians?
So a common misconception for a paediatrician is that we're a podiatrist and that we just look after feet. Obviously, if there was something wrong with children's feet, yes, we can give advice about that, but we're not podiatrists.
How can I get the most out of my visit to a paediatrician?
To make the most out of coming to see your paediatrician, be prepared for a very open discussion about everything about your child. And that can be not just physically, but mentally as well. Sometimes we might get the older children in the room separately. So we might speak to parents separately, children separately, and then all together in the room. So that way we can have very frank, open discussions. Everything will be very confidential too. Before you come to see us, have a think about how you want us to help your child. Perhaps also having a bit of a diary of what's happened leading up to this point. So if you're coming to see us because your child gets sick frequently, having a bit of a diary of what's happened over the year or two or in the whole lifetime. Also, some of those developmental questions that we talked about before, when your child started to walk and talk, and any interventions that were needed in the past. If there's a family history of a genetic problem, if you've got any information about that, that would be great.
A final word.
The final word with paediatricians is that we're here from birth to 18 years of age to help your general practitioner, nurses, allied health professionals to give the best possible outcome for your children with their medical and developmental needs.